Thank you so much for speaking with me today, Christina. I'm eager to learn more about WHO's work. I understand that currently about 1 in 4 survivors have been cut by medical providers. WHO recently launched guidelines to tackle this. Could you explain what's behind this rise in medicalization and what seems to be WHO's key recommendations?
So thank you so much, Huda, for the invitation and for this really important question. Medicalization of FGM is when health workers perform the practice of FGM, whether it happens in a formal health facility or even if it happens outside of a health facility. And this trend is increasingly on the rise, but it has been happening for a long time. In 2010, WHO, along with UN partners and professional associations of health workers, came together to develop a global strategy against FGM. And that strategy really serves as a blueprint or a framework for countries to take action against the medicalization of FGM. And before I go into the content of the global strategy, you asked about the reasons that health workers are performing FGM. And we identified 4 reasons for this. And one is that they're responding to a community demand. So the community that they live in is supportive of FGM, perhaps, and they are subject to the same social norms as others in their community. Some state that they're doing it to reduce harm because they feel that if they don't do it, then someone else will do it, and it may be more harmful in that case. Now, we know that this just continues to perpetuate the practice and legitimize it. There's also an important financial incentive often for health workers. So this is where we really need to intervene and reach the health workers. So the global strategy that was developed includes 4 pillars of action: increasing political will and making sure that there is funding for any activities towards the abandonment of FGM. The second pillar relates to the training of health workers. So making sure that health workers have the skills that they need to prevent FGM and that they have the skills also to manage complications. And the third area relates to different legislative and policy frameworks that can be put in place, and also include codes of conduct for health workers. So health workers may have some sort of penalty, whether they lose their license or they're fined or there's some other sort of punitive response if they perform FGM. And the fourth pillar of action in the global strategy relates to monitoring and evaluation. We have a number of recommendations that are based on the evidence that really address the issue of medicalization, and both from that supply side and from the demand side. So we recognize that communities have the resources and education that they need to take actions and to reduce the request for FGM. And then also for health workers to receive the training that they need. And this is not just training on complications, but the training on how to prevent FGM as well. And there are recommendations also on the legal and policy frameworks that not only are against FGM, but that also support and uphold the rights of women and girls.
Thank you very much. Within the community themselves, they would definitely agree with you if it is a traditional Qatar that is doing it. But with the medicalized aspect of it and the health providers, they would really argue with you that it is a professional who is doing this and that they really know what they are doing. So there is no medical problem with it. So I really think this guideline would really support countries in regulating their health professionals. As a young person myself, I see many youth ready and eager to engage in efforts to end FGMC, whether through education, activism, or advocacy. But in some places, young people face real barriers to being heard or influencing policy. How do you think can WHO strengthen its engagement with young people, especially in contexts where youth face systematic barriers, so that we can play a stronger role in accelerating the end of FGMC?
Thank you so much for this question. And I couldn't agree with you more, Huda. I think it's absolutely critical that we continue to engage young people and hear their voices. We have so much to learn from them in so many ways. And I'm really glad you brought up this question. I can give you a couple examples of some of the ways that we are actively involving young people's voices and perspectives and knowledge into our processes. So one example of this is there's a WHO Youth Council, and this is a network of young people that's intended to amplify the voices and the experiences of young people. And they may come from organizations that promote health, or they may be from organizations that are unrelated to health, because we also recognize that all health issues are impacted by things that happen outside of the health systems as well as within the health systems. And so they are often part of movements, and this youth council is a way to bring them together and ensure that their voices are heard, that their expertise is applied in all of the kind of decision-making processes. So that's a really good example of that. There's also a push to make sure that when we have high-level meetings and countries send their delegations, so they usually send people from ministries of health. So now many more are bringing in youth delegates. And so we're trying to promote this as well to make sure that country delegations include the voices of young people as well. So they have a seat at the table, because the future of all of the health issues that we're facing really will be in the hands of people who are currently young, and it's really important that we engage them from the outset.
Engaging youth is not, optional. It's very important for the long-term efforts to end FGMC. Is facing serious challenges right now. There is reduced funding for women's rights program and increasing pushback against gender equality agendas in many parts of the world. So in this very difficult context, why do you think multi-stakeholder collaboration, especially including youth, communities, governments, and civil society, is so crucial to sustaining and advancing progress to end FGMC?
So, as you mentioned, now more than ever, we have resource constraints, we have competing priorities. Now more than ever, we need to bring together our work and join forces. There is a lot of amazing work that's happening already, and groups that you're involved in and others are working strongly at the community level, and we need to support and accelerate these processes. We need to ensure that we have grassroots organizations involved, but at the same time that we have systems level changes happening as well. So the education system, the health system, the legal system, the child protection system, we all need to work together, listening to those who are working at the grassroots and really trying to learn from them. Most people don't think of the health sector as a place where we can prevent FGM, but we've developed a number of initiatives where we're trying to engage health workers to be opinion leaders as well in ending FGM. If a person comes in for routine health services and she speaks with the nurse, and then she goes and has a conversation with someone else in her community, and then if she listens to something on the radio where she has messages against FGM, if we keep hearing those different messages from different sectors, from different channels, then those messages get reinforced. And I think if we all come together with joined up efforts, I think we can have an even greater impact. So it's a really important question that you brought up.
So, for example, now we're working in many projects where we focus more on FGM, and then we sometimes neglect child protection aspect of it, health, nutrition. But with the young people's mindset, we see the complementarity of all of the structures. So you can see how FGM is a child rights violation. You can see how a child who's undergone FGM can be malnourished, how it can have an effect on their cognitive their skills, how it can affect their education. So now people are ready to see that the violation somehow have effects on each and every aspect of the child's life. So thank you for talking about that.
Thank you so much. Yeah, I couldn't agree with you more, Huda. I know that you work with a lot of groups that are working on the ground. I'm curious to understand from you how you might learn from each other, whether it's across countries or across communities or across organizations. I'm really curious to understand more about how you're part of this building of networks.
when they say that you are the future leaders, they tend to think about more on the future. So we are the powerful advocates of today and of tomorrow, and that our voices can really drive change in improving women and girls' rights. We try to influence decision making and ensure health systems are inclusive and right based. We engage in peer and community educations by teaching the community about sexual and reproductive health, helping to raise awareness and shift behaviors. We normally use media and digital platforms, from social media all the way to radio for hard to reach locations. At the community level, we lead campaigns and open dialogues that challenge gender norms and promote health rights. We are doing a lot, but we still have some challenges. First one being sustaining and scaling these efforts. We need greater support because with youth, we don't really have the resources and that can really help us to continue advocating and community sensitizations. We really have to be meaningfully included in the policy advocacy, and where we can engage in decision makers for youth friendly, gender responsive health policies. We need access to regional youth networks to amplify our voices, and opportunities to represent our communities in a global forums and campaigns. We are really connected and we share information, and we have one agenda, but to have more on a regional youth networks and see how global youth are also engaging would be a very meaningful way. So just to repeat the quote that I use all the time. So engaging youth is not optional, it's essential for us to maintain and scale up our efforts.